Are you wondering which supplemental plan you should go with? Well, you're not alone. Today, we're going to look at the most popular Medigap plans by actual popularity and what seniors are choosing to get the best cost and the most comprehensive coverage. So stick around and let's find out what plan is going to be best for you. Hi, I'm Erika Smiley, one of the lead educators here at MedicareSchool.com, and today we're going to review all of the different supplemental plans that are out there. We're going to look at the two most popular supplemental plans. We'll kind of review how they work and look at the different comparisons between these two plans and the difference in cost. And then we'll actually see what most seniors are doing. We'll look at what percentage of seniors are going with what plan and hopefully help you decide which plan is going to be best for you. All right, so first of all, let's talk about all the different supplemental plans that are out there and have been out there in history. So these supplemental plans have letters for names. Now, there are all these different plans, right? So we have A, B, C, D, F, G, K, L, M, and N. Okay, so a couple of these plans you can no longer get. So the C plan and the F plan, those are for people who were eligible for Medicare before January 1st of 2020. So you can no longer get a C plan or an F plan unless you were eligible for Medicare before January 1st, 2020. So a lot of people out there do have F plans, but they've gotten very pricey, very expensive. They were really popular because they covered everything. They were covered all 6 gaps of Medicare. So if we can't get those anymore, what do we have left to choose from today? Well, the most popular plans now are the G plan and the N plan. So in this video, we're going to focus mainly on the G plan versus the N plan and kind of help you decide which one would be best for you. Okay, so first of all, let's kind of talk about what these supplemental plans do and why you even need one in the first place. Well, if you see, there's 2 sides of original Medicare. One is Part A, which is your inpatient or your hospitalization coverage, and the other is Part B, which is going to be your outpatient coverage. Now, there are 6 gaps in Medicare, and these are financial gaps. So there's 3 on the Part A side, and there's 3 on the Part B side. Okay. So now just a reminder here, if you've worked for 40 quarters or 10 years, 99% of you are going to get Part A for $0. Okay. You're not going to pay anything for Part A. Part B does have a premium that you pay, and the average American in 2025 pays $185 a month. Now, this could be more if you're a high income earner, and there's something called an IRMA, an income related monthly adjustment amount. We always want people to know if you make over a certain income level, they're going to actually look 2 years back at your modified adjusted gross income. And if it's over certain thresholds, you're going to have to pay more than $185 for Part B. So you can always Google or look up IRMA brackets, or you can just watch some of our videos on IRMA to find out what you would pay for Part B. But here's the 2 sides of Medicare. And again, if you have just original Medicare, there's a lot of financial risk to you, and there's a lot of gaps. So we choose a supplemental plan to supplement original Medicare and fill those gaps. Okay. So I talked about that F plan, which you can no longer get. That was for people who were eligible for Medicare before January 1st, 2020. Well, people loved that F plan because it literally covered every single gap of Medicare, all 6 of them. And when you had an F plan, the only thing you paid was your monthly premium. You never paid another penny out of pocket. So if you have an F plan out there, it's probably getting pricey. A lot of people don't know that you can actually, if you could pass medical underwriting, you may want to look at a G plan or an N plan to save money each month. So again, the F plan, we're not going to focus on that today. We're going to focus on the 2 most popular plans now, which is the G plan and the N plan. So let's look at the G plan first. For my example, I'm going to use green marker, G, green, G plan. Okay. So let's look at, out of these 6 gaps, what does the plan G cover? So the plan G is going to cover 5 out of the 6 gaps of Medicare. Okay. So it's the most comprehensive plan that you can get on the market right now, for those of you eligible for Medicare after January 1st, 2020. Okay. So it is going to cover, the Part A deductible. It's going to cover the hospital copays on the Part A side. It's going to cover the skilled nursing facility copays and that gap. It's also going to cover the 80-20 coinsurance split. and it's also going to cover any excess charges. So when you have a G plan, you're going to have 5 out of the 6 gaps covered, okay? So the only thing you're going to pay with a G plan on top of your monthly premium is the Part B deductible, which is the annual calendar year deductible, which is $257. So that's why right now the G plan is the most comprehensive. It's going to fill all these gaps, and all you're responsible for on top of that monthly premium is that Part B deductible of $257. Okay, so let's go through and kind of look deeper at what these gaps are before we get into the end plan, so we can kind of explain some of these. Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. So with the Part A side, we have 3 gaps, and the first one is the Part A deductible. So the Part A deductible is $1,676. Now, this is a benefit period deductible. So this is every 60 days that you're in the hospital. So that means that if you go into the hospital, you pay that $1,676. Let's say you're in there for 2 weeks and then you get out, but you have to go back 3 weeks later. If you're within that 60-day benefit period, that $1,676 is still going to cover you because you paid it in that benefit period. But let's say you're in the hospital in January, and then you pay your $1,676, but later on in August, you have an accident, you have to go back in the hospital, you would have to pay this $1,676 again because it's outside of that 60-day benefit period. So that's the first gap on the A side. The next gap are hospital copays. Okay, so obviously this goes by how many days you're in the hospital. Days 1 through 60 are going to be covered by that $1,676 deductible that you paid. So days 1 through 60, that's going to have you covered. But let's say you have an extended stay. Like heaven forbid you have to be long-term in the hospital. Days 61 through days 90, you're going to pay $419 per day. Days 91 through days 150, if you really have an extended stay, you would have to pay $838 per day for every day you're in there from days 91 to 150. Days 150 after that, Medicare wouldn't cover anything. You'd be on your own and have to pay the full amount. So again, this is a huge gap that you don't want to be financially responsible for. And then the last one on the A side is skilled nursing facility. Days 1 through 20 are covered, so you don't pay anything for days 1 through 20 in a skilled nursing facility. And again, this is if you're released from the hospital. Let's say you need to go rehab. Maybe you've had a hip replacement, knee replacement. You're not ready to go home. You have to go in the skilled nursing facility. Okay. So first 20 days are covered. After that, days 21 through days 100, you would have to pay $209.50 per day. That would add up very quickly. I know my own dad just had some issues, and he was in the hospital, had to go in a skilled nursing facility for 45 days. So he would have really been paying a lot of money out of pocket if he didn't have a supplemental plan to fill those gaps. Okay, so that's the A side and the 3 gaps on the A side. Let's look at the Part B side. So again, we talked about that deductible, the Part B deductible, which this year is $257 for 2025. And that is a calendar year deductible. So once you meet that, you paid that $257, you don't have to pay that again until the next year, calendar year. Okay. Now the second gap, which is the most concerning with original Medicare, is that Medicare pays 80% and you have to pay 20%. So you have a 20% co-insurance, and there's no cap on this. So let's say you have, a $400,000, $500,000 medical bill. Let's say you're diagnosed with cancer or something like that, where you have a huge medical bill and you don't have anything like a supplemental plan to help supplement this. You have to pay 20% out of pocket. That would be a huge financial risk to you. So that 20%, a lot of people don't know about with original Medicare. That's a big one of why we say it's not a great decision to just have original Medicare. You need to have a supplemental plan or an Advantage plan. Okay. And then the last one is something called excess charges. So this doesn't happen very often, and we'll kind of dig more into this in this video, but very few doctors who accept Medicare patients are non-participating. They don't accept Medicare assignment. So they could charge up to 15% on top of the allowed Medicare amount. So if a doctor did charge excess charges, and we'll talk about how rare that is, you could be responsible for that. So that's the third gap on the B side. Okay, so we just looked at the G plan. You see here in green that the G covered 5 out of the 6 gaps, and the only thing you're left with the G plan is that Part B deductible of $257. So now let's look at what an N plan would cover, okay? I'm going to use my purple marker for the N plan. So with the N plan, it's going to cover all 3 of the gaps on the Part A side. So it's going to cover that $1,676 deductible for Part A. It's going to cover those hospital copays, and it's also going to cover the skilled nursing facility gap. Okay, so that's what the N plan will cover there. It's also going to cover you on that 20%. So the N plan is going to fill that gap as well. So here's what you would pay out of pocket if you have an N plan where it's going to leave you open, and that's that $257. So just like a G plan with an N plan, you would also be responsible for that Part B deductible, and that would be $257. And then you could be responsible for the 15% excess charges. Okay, this is one of the big differences between the G plan and the N plan, and we'll talk a little bit more about this because this doesn't impact every state in the country, but it impacts a majority of states. But what excess charges means, again, if a doctor is non-participating, they could charge that 15% overage, and if you have an N plan, you would be responsible for that amount. Now, keep in mind, again, it's very rare. We're going to talk about the percentage and how often this happens, but with the N plan, you would be responsible for excess charges. Now, the only other thing that you have with an N plan, or you do have some copays when you go to the doctor. So you would have to pay, it could be up to $20 for an office visit if you have an N plan, or it could be up to $50 for an emergency room visit. Now, with the G plan, you don't have those copays. When you go to the doctor, you don't pay anything. You just show them your Medicare card, show them your G plan card. You'd have to have that $257 deductible, but you're not going to have to pay a copay every time you go to the doctor. With an N plan, you would have to pay a copay when you go to the doctor. Could be $10, could be $15, $20. It'll never be more than $20. In an emergency room visit, you would have to pay a $50 copay, but a lot of times if you're admitted to the hospital, they will waive that copay. Okay, so those are the main differences with a G plan and with an N plan. The G plan is going to cover 5 out of the 6 gaps in Medicare, and then the N plan is going to cover 4 out of the 6 gaps in Medicare, and you have a few copays as well. All right, so you may say, why would I pay every month to have a supplemental plan when I could just get an Advantage plan for $0? Well, you're getting a lot of peace of mind and comprehensive coverage with these supplemental plans. So it gives you a little bit more freedom and flexibility. So let's go through some of the main kind of, I don't want to say perks, but the main highlights of supplemental plans, okay? So the first one is that you have no networks. So with a supplemental plan, you can go see any doctor in the country that accepts original Medicare, and that's about 98% of doctors. So if you travel a lot or if you're a snowbird, you can go see any doctor, okay? You don't have to worry about, is my doctor in network, out of network, HMO, PPO? You don't have any of that with a supplemental plan. Doesn't matter if you have an F, a G, or an N. It's all the same for all supplemental plans, okay? So no networks. The other thing is no prior authorizations. So prior authorizations are a thing with Advantage plans that can cause a lot of red tape and headaches, and that's where the insurance company has to approve the care that you're going to get and the procedures that the doctor wants to give you. Now, we don't have to worry so much about prior authorizations with supplemental plans. So if your doctor says, hey, you need to have hip replacement surgery, you and your doctor are in control of that. You're going to schedule the surgery and you're going to have it. With the Advantage plans, there's a lot of prior authorizations and red tape where insurance company could deny that. They're going to have to find that it's medically necessary. So we don't have that as much with the supplemental plans. You and your doctor are in control of your health care, not the insurance carriers, okay? So that's a big plus and a lot of freedom and less hassle. Okay, so no referrals. So again, we have no networks, no HMO, no PPO. So you don't have to get a referral from a primary care physician to go to a specialist. If you need to go see that orthopedic doctor or that cardiologist or that urologist, you can just call and schedule directly with that doctor. Okay. Now, these policies are also portable. So what that means is if you move, you can take your G plan with you. Okay. You don't have to stick to a local network or change plans if you move. The other thing is this is a lifetime policy. So this plan is yours forever. They can't say, well, you're getting older or you're getting sicker or we're going to change this coverage. As long as you pay your monthly premium, they can never cancel the plan on you. Okay. So there's either no copays or minimum copays, depending on which plan you have. So with that G plan, remember, when you go to the doctor, you're not going to have copays. All you're going to have is that $257 deductible. Once you pay your first $257 for the year, then everything else is covered. So with a G plan, there's no copays, okay? And I say minimum copays because if you do have an N plan, remember, again, you can have that low up to $20 for an office visit, up to $50 for an ER visit, okay? But you're not going to have copays every time you get an X-ray or an MRI or procedure. It's just going to be those office visits, okay? Now, the other thing is max out of pocket. So a lot of people, they don't have huge nest egg or savings maybe to handle a major medical emergency. So this is kind of a perk of these supplemental plans is you know what your monthly premium is going to be. Maybe your G plan costs $170 a month. Well, you know that's what you're going to pay, but really your max out of pocket with the G plan, the only thing is that $257. So no matter what happens to you, if you have to have open heart surgery, if you have cancer, if you're in the hospital for a month, you're not going to get huge thousands and thousands of dollars in medical bills that all hit you at once. You pay your monthly premium and then you're going to pay that $257 and everything else is covered, right? Now the max out of the pocket with the N plan, same thing. You pay the $257, you pay those small copays when you go to the doctor, and there is that excess charges, but we're going to talk more in this video about how rare that is and how to avoid those excess charges, okay? So again, no surprises with these supplemental plans. You know what your monthly premium is. You know what you have to pay out of pocket. You're not going to get hit with like $8,000 or $9,000 in medical bills all at one time. Okay. So these are kind of the main things. They just give you a lot of freedom and flexibility and peace of mind. And that's why a lot of people like these supplemental plans. So how and when can you get one of these supplemental plans? Well, you have something called a Medigap OEP. Now that stands for open enrollment period. Okay. So now this is a 6-month window that lines up with your Part B start date. So when you enroll in Medicare Part B, you're going to have a Medicare card, and you're going to have a Part A start date on that card and a Part B start date on that card. And they could be different depending on when you came into Medicare, if you continued to work past age 65. But it doesn't matter when you came into Medicare. It only matters your Part B start date. Okay, so you're going to have a 6-month window from this Part B start date that you can get a supplemental plan. Doesn't matter if it's a G or an N, with no medical questions asked. Doesn't matter if you had a heart attack 3 weeks ago. They don't know because they're not going to ask you, and you're guaranteed to be issued a supplemental plan. Now, this is really important because we want people to know if you miss this 6-month window and you're past that, you will probably have to go through medical underwriting. And what that is, it's not a physical exam, but it's about 30 to 40 questions about your current health, your past health. And if you have any issues, really, like it could be cancer, heart attack, diabetes, high blood pressure that's uncontrolled, osteoporosis with falls and fractures, there's a lot of different things that could disqualify you. And they just say, nope, we're not going to give this person a supplemental plan. They're too high risk. And you've lost your chance for your whole life to get a supplemental plan. So you want to make sure that you know about this 6-month window. And to give you a better example, let's say someone's start date was April 1st of 2025. It's 2025 right now, and that's their Part B start date. We're going to count the month of April because it's through those 6 months. So we'd count April, May, June, July, August, September. So pretty much the last day of September 2025 would be their last chance to get a supplemental plan. Now, there are a couple states where they're open enrollment all year. Those are New York, Connecticut, Massachusetts, Massachusetts. But outside of those states, if you miss this 6-month Medigap OEP, you are going to have to go through medical underwriting. So make sure you know that. If you want to get one of these plans, make sure you do it in that time frame. So hopefully you're kind of getting a grasp here on the G plan versus the N plan and what the differences are. But I really want to dig into this excess charges, because I think a lot of times people are worried about excess charges, and that's the main factor that makes them go with a G plan versus an N plan. Now, of course, G plan is the most comprehensive. It's going to cover 5 out of 6 gaps in Medicare. So if it's in your budget, you have a good price for a G plan, go for it. But if your G plan rate is high and you're considering the N plan, how serious are these excess charges? Well, let's look at some numbers here. Again, we talk about an excess charge. It would be a doctor that will see a Medicare patient, but they're considered non-participating. They don't accept Medicare assignment, and they could charge up to 15% over the Medicare allowed amount. Well, 96 to 97% of doctors who see Medicare patients are participating. So that only leaves 3 to 4% of doctors that see Medicare patients as non-participating. And CMS actually reported that less than 1% of Medicare claims actually had excess charges on them. So again, it's very rare. Less than 1% of Medicare claims have an excess charge on them. And here's the thing. You can call a doctor before you go and say, hey, are you participating with Medicare? Do you accept Medicare assignment? Or do you charge excess charges? You could always call ahead of time before you go to that doctor, talk to somebody in billing, and they should be able to give you the answer so you could avoid those excess charges. But they're very rare. Now, there are about 8 states where it's actually illegal for them to charge excess charges. So if you're in Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, or Vermont, excess charges are illegal in these states. So they cannot charge you that excess charge. So if you're in one of those places, go with an N plan and you can save some money. All right, let's look at the cost of the average of these plans, okay? Because this could be a huge factor in deciding which plan you want to go with, okay? Now, I'm a licensed agent myself, and I talk to people and help them with their plans all across the country. So these are going to be kind of the average of what we see nationally. It can matter on your price due to where you live, what city and state you live in, if you're male or female, we see some differences, or your age, okay? But the average G plan is going to cost somewhere between about $150 to $200. Now, yes, they can be a lot more. If you're in areas like California, New York, we have certain states where they've had significant increases. They could be more than that. But across the country, I think the average rate in 2025 is about $154 for a G plan. So that's going to be your monthly premium, somewhere in that category of what you're going to pay for your coverage. Now, with an N plan, we've seen N plans as low as about $90 up to about $140. So depending on where you live, you could save anywhere usually between $30 to $50 a month if you go with an N plan, okay? So you just kind of have to outweigh the risk and the benefits. Like, do I go to the doctor a lot? Do I mind paying a copay every now and then with an N plan? Do I want to make sure I don't go to a doctor who charges excess charges, okay? But it could add up and really save you a lot of money if you're saving $50 a month on an N plan versus a G plan. So again, you can always reach out to us. We're brokers. We're not tied to any one carrier. We can actually look up your zip code, where you are, and see all the different options for the G plans and the N plans and tell you what's going to be the best price option for you. So let's get down to it now and look at what most seniors are choosing in the year 2025. What's the most popular plan? Well, research shows that in 2025, about 39% of seniors who have a supplemental plan have a G plan. And about 10% of seniors who have supplemental plans have the N plan. So the G plan is the most comprehensive. Even though it has a higher price tag, it's the most popular. And I think it's just knowing you have that peace of mind that you're covered. You're going to pay your monthly premium. You can budget that out. And then on top of that, all you have to pay is that Part B deductible of $257. So G right now is the most popular. And you might say, well, what is everybody else doing who doesn't fall in these categories. Well, keep in mind, there's a lot of people out there who have supplemental plans, and they might be on an F plan because they were eligible for Medicare before January 1st of 2020. But right now, the most popular plans are the G and the N, and the G wins out at 39%. So again, hopefully this has answered some questions for you about which direction you want to go. If you're in your window or getting close to it, you want to call us and talk about what the rates are in your area. We're always happy to help. You can schedule an appointment with one of our guides. Now, if you're still on the fence and you can't decide if a supplemental plan or an Advantage plan is best for you, you can go check out this video to get a better comparison.